morning. My name is Brianna. I'm a nursing student and I'm here to show you how to take off a wound dressing and how to reapply it using the wet to dry method. So first thing I'm going to do is check my PCP orders. I'm going to check what type of dressing needs to be changed and at what time. Once I've verified all that, I'm going to go ahead and gather my supplies. I need to make sure I have all my irrigation, my wound kit, any extra gauze or waterproof pads that I need, and then I'm going to go to the patient's room. I'm going to provide privacy. Good morning, Mr. Smith. My name is Brianna. I am your student nurse today. I'm here to go ahead and change the dressing on your leg. Can you go ahead and verify your name and date of birth for me? Okay, perfect. And do you have any allergies that I need to be aware of, especially to latex or tape? No? Okay, great. All right, so next I'm going to perform hand hygiene. I'm going to go ahead and put on my gloves. And I'm going to start my setup before we get started. I'm going to pull this down. This is the wound on his leg. I'm going to go ahead and get our kits ready. I'm going to make sure to place a waterproof pad under my patient. And put my sterile water. Go ahead and get the biohazard bag ready. Okay, so now that I've got everything ready to start, I'm going to go ahead and start by removing the dressing. You want to pull the skin down and pull the tape away from the patient. I'm going to start by assessing the pad to make sure that I don't see any discharge, any blood. I'm checking for the odor, the consistency of any contents on it. I'm going to fold it over on itself and put it in a biohazard bag. Next, I'm going to pull out the dressing and I'm going to count how many pieces I pull out. So this is 1, 2, 3. Okay, again, I'm going to check for any color, consistency, odor that I would need to assess. Next, I'm going to go ahead and remove my gloves. Using proper technique, making sure that I don't touch any of the surfaces. I'm going to perform hand hygiene again. I'm going to put on fresh gloves. Next, I'm going to clean the wound. I'm going to irrigate it. You want to move from least contaminated to most contaminated and don't cross-contaminate them again once you're cleaning. So this side is less contaminated, so we're going to start over here. And we're just going to irrigate that wound. Okay, we're going to go one more time. All right, I'm gonna put this back in here. and I'm gonna go ahead and pat dry. I need more gauze. Okay, I'm going to gently pat dry the wound. Okay, put that in the biohazard bag. And then I'm going to go ahead and measure the wound. You're going to measure the length first. You're going to use centimeters. Our wound is 12 and a half centimeters, and then we're going to do the width. It's going to be 3 3/4. Okay, and then we're going to measure the depth, and the way that you do that is you use a Q-tip. And you go ahead and stick it down in the wound. You're going to measure how far down it goes, and then you can measure it on your centimeter line. So it's right at 3.5 inches. Okay? Next, I'm going to go ahead and remove my gloves, perform hand hygiene, and put on fresh gloves. So now I'm going to go ahead and prepare the new dressing for the patient. So I'm going to go ahead and dampen some gauze. I have a pretty deep wound here, so I'm going to count how many pads. So I have 1, 2, 3. I'm going to do a 4th one just in case we need it. 4. So I'm going to go ahead and take my sterile water that I have. I'm just going to wet everything. Make sure that it's all saturated. Okay. Next, I'm going to go ahead and take them out one at a time. I'm going to squeeze out any excess fluid. You're going to fluff the gauze. And then you're going to start packing the wound. I might need one more in the deepest part of the wound, so I am going to go ahead and use my 4th one. Okay, next I'm going to finish packing the wound by using a Q-tip. You're just going to gently press it down into the wound around the edges. You want to make sure that the dressing does not touch the edges though, because it can cause more skin breakdown. Okay, so once my wound is packed, I'm going to dispose of that. I'm going to cover it with a dry gauze. So I have 1, 2. I'm going to put 2 on the other side. Okay, next I'll have my ABD pad. Go ahead and place that over. And then I'm going to use tape to tape down the edges.
Okay. Oh. You got no.
Okay, lastly, I would go ahead and mark the dressing with my initials and the date and time. Then I would go ahead and remove my gloves. Finish cleaning everything up. Perform hand hygiene. And make sure that the patient was comfortable. Okay, Mr. Smith, are you doing okay? Are you comfortable? Okay, good. Well, I'm going to go ahead and put the call light right here. If you have any questions, just call me and I should be back in 30 minutes to check on you. And then I would exit the room and go ahead and document any findings that I saw with the dressing, the number of gauze that I used for the procedure, and any other documentation that I need to do.